How do you tailor treatment for an individual patient?
We look at the family dynamics, we look at the personality and behavioral aspects of the child, and we may introduce this very slowly. We have gender-specific videos that the children can view and with and without their parents. We may have some children talk to other children about this, where other families have already started catheterization and even come off catheterization because of its success. And then we start, when we actually teach them catheterization, it may take more than one session. They may have to come back to the hospital a second or third time. And then we tailor how often they have to do this based on their willingness and acceptance of the program. We feel it's important they need to mimic what they do normally in life. But if we can get them to catheterize and empty their bladder at least twice a day to start, at least that's a beginning. Then we get them to try to catheterize a third time so that they do it before they leave for school, when they come home from school, and before they go to bed. It doesn't mean that the children shouldn't try to urinate while they're in school. We also encourage them to urinate as often as they can. And then we try to get them to do catheterization during the school hours, because in many cases the school day is very long and they need to empty their bladder. We work with school nurses. Our nurses work with the school nurses so that everybody is on the same page in getting the children to catheterize. So it's a gradual process, and the speed at which we get them doing this regularly and fully depends on the individual child and the parents.